The power of radio is in your hands. You can play. You can pause.
Rewind.
You can download. It's Vicalonia Radio. Solely for your listening pleasure. You are listening to your number one online edutainment radio.
Did you know that the greatest gift you can give your family and the world is a healthy you? To learn about your health and get tips to maintain a healthy lifestyle, tune in to Health Focus on Vicalonia Radio at 10 a.m. on weekdays. Your greatest wealth is your health. Stay healthy.
Everyone, and good morning. Is another wonderful Saturday on a show, Health Focused. You're welcome to your number one entertainment radio, Vicalonia Radio. I still remain your humble host, Dr. Daniel Purity. And on our show this morning, we'll be dealing with self-medication and its implication to our health. And right here with me, I have a lovely doctor. Doctor, can you say hi to your audience?
Hi, audience. I'm Dr. Odo Zephaniah. I'm happy to be on the show this morning.
Wow, that's great. So, Dr. Odo, we are happy to have you on our show this morning. And concerning self-medication, in a jiffy, what would you say is self-medication? And could you give us some instances about self-medication?
Thank you very much for the question. Self-medication can be said to be the use of drugs to treat a condition that one thinks he or she has, or symptoms, or the intermittent or continued use of prescribed drugs for a condition that has been there for a long time, which we say to be chronic, or a condition that keeps reoccurring. For instance, one might start feeling headache, fever, generalized body weakness, vomiting, and says, "Oh, I think I've got typhoid fever," and just goes straight to a patent medicine dealer and demands for certain medications assumed to cure typhoid fever and starts taking them. In another instance, one who has been diagnosed of hypertension, that is elevated blood pressure, by a medical doctor and given prescription for certain antihypertensives to be taken for like 2 weeks and then come back to the doctor for a checkup. This individual procures the prescribed drugs, takes them for the 2 weeks prescribed, feels that he is okay now, and fails to go back to the doctor for checkup. Then after some time, when he probably starts feeling headache, he will say that maybe his blood pressure is elevated again. Then he picks the prescription the doctor gave him during his last visit, walks to a drugstore and procures them and starts taking them without seeing the doctor again. This attitude to one's health is reckless, to say the least, as this fellow could literally cause his own untimely demise. This is because in the case of the hypertension, this patient's blood pressure could be at certain levels or coexist with other conditions like heart or kidney problems, which would affect the class, combinations, and duration of the antihypertensive the doctor would have recommended for him if he had gone back on the checkup visit. Self-medication is very common in developing countries due to mainly poverty, ignorance, and non-availability of health facilities. Drugs most commonly implicated in self-medications, especially in developing countries like Nigeria, include antibiotics, anti-malaria, analgesics, that is your painkillers, antihypertensives, your diabetic drugs, we call it hypoglycemics, sedative hypnotics, alcohol, and a lot of them that we can't list now.
Okay, thank you so much for that. So, having explained what self-medication is and giving us some instances, are there any advantages of self-medication? If yes, could you tell us some of them?
Definitely. Self-medication has advantages, but before I say the advantages of self-medication, let me point out that we could largely divide self-medication into responsible and irresponsible self-medication. The responsible self-medication are the ones that have advantages, in which you start looking at some of them to include the roles that they play in healthcare, and with the continued improvement in people's education, general knowledge, socioeconomic status, self-medication has really been successfully integrated into many healthcare systems throughout the world. The responsible self-medication can be used to prevent and treat symptoms and ailments that do not need medical consultation or oversight. This reduces pressure you have on our medical systems and services, especially when these are limited, like here in our environment. For those populations living in rural or remote areas where access to medical services may be difficult, patients are able to control their own conditions to a greater extent, such that only if the condition fails to respond or persists or becomes more severe will the patient need to seek professional medical care. Drugs used for responsible self-medications are called self-medication products or over-the-counter medications. They are those drugs not requiring a medical prescription and which are produced, distributed and sold to consumers for use on their own initiatives. This is as opposed to your prescription-only medicine, which are more specialized and dangerous drugs which should only be used with doctor's prescription and oversight.
Okay, so what do you think are the disadvantages of self-medication? Because anything that had advantage had disadvantage.
Sure. Irresponsible self-medication, like I said, is now the place that you find the mirage of disadvantages associated with self-medications. Irresponsible self-medication will have a lot of disadvantages and poses serious danger to the individuals involved due to incorrect self-diagnosis. One would say that he has something that he may not have, delays in seeking medical advice when needed, infrequent but severe adverse reactions you could get from some drugs, dangerous drug interactions, incorrect manner of administration, drug that one should take sublingually, for example, you might end up swallowing it, and all that, incorrect dosages, incorrect choice of therapy, masking of a severe disease and risk of dependence and abuse. Due to common availability of antibiotics, especially in an environment, there has been serious problem of antimicrobial resistance. This has increased cost of treatment, prolonged morbidity and mortality from microbial infections. You see a condition that maybe ordinary ampiclox could have cured, but due to abuse of that ampiclox, you see that eventually when the doctor even prescribes the ampiclox, it will not affect the condition. You end up going up to costlier and rarer drugs like your meronem and all that. These are the effects of abuse and self-medication. Also, abuse of analgesics, which is of painkillers, especially paracetamol, and the non-steroidal anti-inflammatory drugs like your ibuprofen, diclofenac, has resulted in widespread dyspepsia, that is chest pains, and chronic renal failures in our environment. Self-medication with direct or indirect sedative hypnotics or your CNS depressant, all these sleeping pills and drugs what people take to feel better, to feel good, to calm their nerves, especially drivers, operators of heavy machineries, have led to a lot of avoidable loss of lives and injuries. I could go on and on and on, but for want of time, I would stop here.
So, do you have any recommendation on how to prevent or reduce self-medication in our environment?
Definitely. Firstly, in a country such as ours, I strongly recommend that the government establish more functional health facilities, especially in the rural areas, and employ more health practitioners, especially medical doctors in these facilities that attend to the ailing population. Because in this country, you have a situation where you have a lot of primary health care centers, but all you have there are probably highest you have nurses and poorly trained personnel, And when you have serious ailments that will require the services of probably a doctor, you have nowhere to find one. So it's very important that government establish more facilities and then employ more qualified personnel in those facilities. Secondly, healthcare providers should also educate patients on the dangers of self-medication. Such messages should be extended to the community at large periodically by even government health ministries. Government should enforce relevant legislations which limits the sales of drugs without prescription to only few relatively harmless over-the-counter ones. We have legislations in this country where, legislation like patent medicine dealers that they are commonly called chemists should not sell drugs like tramadol is a common one. They are not allowed to sell morphine and all that. But then how much are those legislations enforced? So government needs to look at that. Finally, there is also need to create awareness about existing health facilities so that patients will know where to go when the need arises, thereby minimizing the potential resort to self-medication.
Wow. So, having said all this, what are your final advice on self-medication? Would you like to leave with our thousands of listeners who are listening to us this morning?
Wow, thank you for that. I would want to summarize my advice to our teaming audience out there this morning with this slogan, which is, when you are sick, seek a doctor. They say delay is dangerous, especially when it comes to health issues. Please do not gamble with your life. You have only one life, or that of your loved ones, by indulging in irresponsible self-medication. You must practice safe and responsible self-medication, and never forget our slogan for the week, which is, when you are sick, seek a doctor. Thank you very much.
Well, thank you, Dr. Zephaniah, for this wonderful talk. So I believe you've heard it all. Self-medication, they have the responsible and the irresponsible self-medication. Practice the self-medication if need be, but in absence of that, seek your doctor when you're sick to get the right prescription, the right drug, the right diagnosis, the right treatment and dosage for the drug in order to get well. Stay healthy. Keep listening to Wikilonia Radio. I still remain your humble host, Dr. Purity. Have a wonderful day. See you next week. Bye.